John, thank you so much. And yes, we do have Dr. Weis with us today. June is Men's Health Month, a time dedicated to raising awareness about the importance of men's health and well-being. And that's how we have Dr. Brian Weis with us, Regional Dean from TTU HSC School of Medicine. We're going to talk about the importance of prostate and colon cancer screenings, cholesterol management, and maintaining a healthy weight and staying active. So Dr. Weis, thanks for coming in.
Sure, absolutely.
And to start things off, can you tell me a little bit more about why screenings for prostate and colon cancer are just so important for men?
Well, this may come as a surprise to a lot of women, but men tend not to be very good about taking care of their health.
Oh, yes.
And I always say, when men would come to my clinic, I'd say, "Oh, why are you here?" And they're like, "My wife made me come." All right, that's usually a pretty good reason. All right, but you think about, in terms of, we want to think about preventive care. Okay,
yes.
Reactive care is when someone gets sick and we have to react to that. Preventive care means let's think ahead and try to prevent people from getting sick. For men, primarily it's the prostate and the colon that we watch out for cancer.
Right.
So you think about right now, the recommendations are age 45 for colon cancer screening. So the government's moved it back from 50 to 45 because we're seeing a lot of younger people with colon cancer. So we're saying men, women, age 45, that's when to start with the colonoscopies and colon screening.
Wow.
Now the other thing for men is the prostate. And the prostate's a gland that lives in our pelvis. And as men, it always gets bigger as we get older. That's what leads a lot of times to some of the urination problems. But prostate cancer is fairly common in men. Now, we used to do a rectal exam to look for prostate cancer.
Yes.
Not a very sensitive test. Kind of sensitive to the patient, but not very sensitive for the doctor. Now we can actually screen for prostate cancer with a blood test.
Oh,
and so that's exciting. So the recommendations are now from age 50 on, men should be screened for prostate cancer unless they have younger men in their family that had prostate cancer, like their father or their uncles.
Yeah.
Then we screen typically 5 to 10 years before that case to make sure that we're picking up prostate cancer in younger men.
Oh, wow. Okay, I did not know that. And also heart health is another concern when it comes for men. Can you tell me a little bit more about the cholesterol management? Yeah,
so cholesterol, people hear about cholesterol. We really discovered the cholesterol story in the 1980s, and we know that there are several different forms of cholesterol. There's a bad one called LDL. That's the one that we know the higher that is in the blood, the more likely people are to have heart disease when they're older in life. There's also a good cholesterol called HDL, and HDL, the higher that is, it seems to be protective of heart disease. Women tend to have higher HDLs overall, 60, 70.
Yes.
We men tend to have lower HDLs, 35, 40, 45. Okay? But we check those, and that way if we can find that maybe a man or even a woman earlier in life has a problem with having too high an LDL or too low HDL, we have lots of good medications to adjust that, hopefully to prevent heart disease later in life.
Sounds great. And for those that are wanting to get active, what advice do you have for the men?
I cannot preach enough about the benefits of exercise. I mean, there's nothing a doctor can do for you that has as many benefits as exercise. The federal government recommends that if you want to maintain your health, they recommend 30 or 150 minutes a week of moderate exercise. That's basically 30 minutes a day for 5 days a week.
Which isn't bad.
Yeah. You say, what's moderate exercise? That's defined as exercise where you can talk while you're doing it, but you can't sing. Okay? That's what we consider moderate exercise. But we know that maintains health. So again, it doesn't mean you got to sit there and power lift and run 26 miles. It's just 30 minutes a day for 5 days a week of moderate exercise. We know can really help the body and maintain health.
Well, Dr. Weis, thank you for coming in and just giving us some great information for today's segment. I greatly appreciate it.
Sure, absolutely. Thanks for having me.
Of course. And we have more Studio 4 coming up after the break.